Our next speaker is Dr. Andrew Bowman. Dr. Bowman is from Ohio State University College of Veterinary Medicine, and he is going to present on animal hosts and their impact on humans with an emphasis on the past flu pandemics. I think that this is going to be a very enlightening topic. As you know, we're getting more and more reports of possible animal hosts with SARS-CoV-2. There was recently a report of infections in humans in the United States that was caused by the coronavirus being in minks, which then spread to humans. And so this, I think, is a very important topic, because if indeed this virus starts spreading in the animal population, it's going to be very difficult, if not impossible, to control, especially if it skips from domesticated animals or from farm animals into wild animals such as white-tailed deer. And so all of this is a potential problem. So at this point, I'd like to turn the floor over to Dr. Bowman.
All right. Thank you so much for having me. Yeah, so coming to you from the Department of Preventive Medicine at The Ohio State University, spend an awful lot of my time looking at animal-human interface, specifically looking at viruses of human consequence in animal populations. And yeah, we've done some of that work of SARS-CoV-2 and white-tailed deer and had that initial detection. And today we're going to keep it to influenza because we've got a little more data to talk about. But nonetheless, this idea of the animal-human interface certainly is shaping human health, whether we go all the way back to the idea that SARS-CoV-2 came out of an animal host somewhere into humans. And now that we see it maybe spilling back into, we do see it spilling back into animals, what that's going to mean long-term, who knows? But we'll get into the influenza thing. And so influenza is a game of who's giving what to whom. And I know on the human health side, we're really focused on the seasonal aspect of influenza. But if we sit and think about influenza A virus and where it is and which species it's in, and we trace all of that back to wild birds and being the primary natural reservoir of almost all the genetic diversity we see in influenza viruses, general dogma is we have spillover from wild birds into poultry. And so that's a major host jump that we think about wild birds. That's wild waterfowl. That's an enteric infection in those birds. Moving into poultry as a respiratory infection, from there probably into lower mammals and then into humans, and certainly becomes established in each of those different hosts, and we get host adaptations, and every once in a while we see those spill over. From here on, we're probably going to stay focused on this swine-human interface, as that's been fairly active. It was the cause of the 2009 pandemic, really has been one of those that's gotten a lot of interest lately. And just as a reminder, I mentioned the seasonal influenza issue, and remember that those are all descendants of pandemic viruses. The fate of a pandemic virus, once it's in the human population, is it eventually becomes our seasonal strains until it gets replaced with another pandemic. So we just have to give nod to the idea that we're, every time we get the new pandemic flu virus, it's eventually going to become our seasonal strains as well. So we're going to talk about influenza at county fairs. And I think most of you have probably either been to a county fair or know of a county fair and understand that whole aspect of the county fairs. It's gotten a lot of headlines over the last few years about influenza in the pigs, and sometimes we have zoonotic transmissions at those settings. And so certainly an interface that's gotten our attention and made us pay attention to the fact that maybe we don't need for an animal-human interface in far parts of the world. We certainly think about live animal markets in Southeast Asia as being conducive to zoonotic transmission, but potentially we have it occurring here in the U.S., in every county across the country as we have these county fairs occurring. So my research group has been doing influenza surveillance at county fairs since the 2009 pandemic, right? This was originally how do we get our hands on pigs to figure out what viruses are circulating in them from a pandemic potential standpoint. We've used fairs as the way to get pigs from lots of farms at one spot instead of having to go farm to farm to farm to figure out which strains are out there. We let them commingle at a fair and then do that sampling there. Our years of experience now, I would say about 25% of the fairs we visit every year have pigs shedding influenza A virus. So it's not an uncommon finding for us. When we're out there doing active surveillance, we try to play a fun little game of flu or no flu. And that's exactly how exciting our lives are at times on our way home from the fair. We play that fun game, and we're really not good at predicting it. We know that lots of those pigs, in fact, most of them, are not displaying clinical signs at the time of sample collection, but we're getting positives. We also know that if a fair has one positive pig, it's quite likely that greater than 60% of the pigs are going to test positive, right? And so this is a function of us sampling at the end of the fair after we've had time for a virus to transmit through the fair, through the pig population, and then we're picking up positives at the end. If we think about truly the public health importance of the county fair and the zoonotic transmission, since 2005, we've had more than 480 reported infections of variant influenza viruses. So variant just meaning that we're having a swine origin virus introduced into a person, and realize that's always the fear of that's how the next pandemic starts. So all of those have to get run down as a potential start of human transmission and follow up. If we look at the vast majority of those cases, those are folks that have had direct or indirect transmission with pigs at county fairs. And so these are exhibitors or their family members for the most part. And if you just think about what we have occurring at that interface, it's radically different than what we have in mainstream society. You can see the picture of Lexi there in the lower left-hand corner, right, celebrating her 13th birthday, face to face with her pig with her cake. Like, that's not something we find in the rest of society, but it's certainly occurring in these settings. So, important distinction that these are exhibition swine that we've been focused on. These are not commercial swine. 66 million pigs in this country at any given time. This is only 1.5% of the total pig population. These are non-commercial swine that are being raised for youth education programs. So this is 4-H, FFA, some of those sorts of things that are being, really raised specifically for this setting, these competitions. If you think about what we do at the county fair, we basically violate every tenet of biosecurity that we're preaching to the commercial industry, where we bring pigs from multiple sources to one spot. We co-house them together for a prolonged period of time. And then we invite the public in. Actually, oftentimes we charge the public to come into that environment. And then we have really created the environment that's conducive to zoonotic transmission. Somewhere around 150 million people visiting fairs every year. So we have that opportunity that we just don't have elsewhere, whether it's that stroller, the sippy cups coming down through the pig barn. You can't really go visit a large commercial swine operation and have that setting, but you certainly can at the county fair. In fact, it's encouraged there. So exhibition pigs, right, the distribution of it's a little bit different. And so, believe it or not, in the middle of the country, it's not all pigs everywhere. Certainly Iowa's got the concentration of it, and you can see total swine inventory showing that distribution. However, when we look at exhibition pigs, we got a different distribution. And so Ohio, Indiana, Southern Tier, Michigan certainly have a higher number of exhibition pigs, and we could talk probably all day long about why is that the case, but certainly it is. We have more pigs at county fairs. It's just a different environment than we have in lots of other parts of the country. If you go look at where the variant cases have been, Ohio, Indiana, Southern Tier, and Michigan certainly are leading the way. And so this interface in those settings has that potential for zoonotic transmission to occur and potential start of the next pandemic. We've had a policy working group come together and try to put some policies around this. And you can see we had a whole bunch of folks involved in writing measures to minimize documents. Reality is the vast majority of that was written on intuition and, best practices that we thought. When you sit down to it, we didn't have a whole lot of science to support any of these things. And so from there, my research group's probably been doing quite a bit of work on trying to figure out, do these things work? Do they not work? Get some data to support these recommendations with the idea of how do we protect not only swine health, but protect public health. So if we look at what those mitigation strategies are, the idea is that we've got a few things on there, one of which is that we're going to shorten the duration of swine exhibitions, or we certainly could shorten the duration of swine exhibitions. The idea here is that we can't keep influenza out of that setting. At least some pigs are going to come in infected. And then from there, right, it's going to amplify through that population. In this study, we sampled pigs at county fairs and followed them over time to see how much virus amplification occurs over time. The dotted line there's indicating the 72-hour mark, which has been put out as a potential recommendation for how long we might be able to keep pigs at the fair and have at least a decreased risk of transmission to humans. Obviously, we don't know what the magical threshold is of how much is going to protect the human, but certainly decreasing it is going to be less virus, less viral burden. So we can infer that we'd have protection of public health. If you look at these curves, you can certainly see that if we let the fairs just go as they would, and you can see some of those fairs by the end of the fair, nearly every pig is testing positive with influenza. So if you think about the high viral burden that's going to be occurring in those settings, it's probably really shouldn't be that surprising to us that we end up with zoonotic transmissions occurring, where we're talking about a couple hundred pigs in one barn shedding influenza, and then we've got their caretakers in there sometimes for most of the day. So certainly the idea that we could have that infection occurring. If we knock it down to the 72-hour mark, you can see we have a dramatic decrease. Even in the worst case fairs, we're down under 35% of the animals testing positive at the 72-hour mark. Totally own the fact that those animals are exposed and will likely begin shedding once they're not at the fair, but at least they're not on public display and likely not infecting people. And so we think we've got a recommendation that we could put out there that would improve public health. The other nice part of this is the buy-in does not need to be at the exhibitor level. I don't have to try to convince every exhibitor to do something to their animal. In this case, the show organizers have control. They could organize their shows to decrease that time to get pigs off the fairgrounds by 72 hours. The next thing we're going to talk about is the weigh-in effect. And so if we jump back and we look at those couple fairs that started with a rather high prevalence and then drop, and you wonder what in the world happened there. In this sampling, it was the effect of when we could first get a sample from those pigs and we could identify them to follow them through time. And so that was at a weigh-in event. And so the weigh-in event that they're lining pigs up in the barn and they're moving them through a corral system, and then they stop on the scale, they weigh the pig, they get an ear tag, all those sorts of things so that they're identified and entered into the competition. What we found is that practice of lining them up head to tail, moving them through the chute system is probably a good way to disseminate flu virus. And so what we have here is the time scale of one of these weigh-in events. Across the x-axis, our CT values are shown on the y-axis. And so remember, a lower value is going to be a stronger positive. As we move through time, you can see all those little blue dots, which are representing each pig that we sample. Move through time, right? Everybody's negative. They're above 40, maybe a couple suspects in there. And nonetheless, we get about 10:30 in the morning and we hit our first positive pigs, and really the bottom drops out, right? And we're getting all sorts of positive animals after that. And it continues to follow for the next couple hours that most of those animals are coming up positive. The red squares there are really showing the environmental surfaces that we're sampling in there as well. And red meaning we've got virus isolation positive. So what's happening is we have one or two pigs who are actively shedding influenza come through the chute system. And as they come through, they're depositing virus on those common surfaces that every pig after it is touching with their snout. Our sampling technique was to wipe those snouts as they come through. And so we're picking up residual influenza that's now been deposited on the nose of each pig behind it. So probably not actively infected and shedding, but certainly exposed as they come through there. So it's not the usual transmission of one pig gives it to its neighbors and then it gives it to its neighbors. In the normal transmission dynamics, we think here we're having mass exposure effect as they come through. Depending on where the one or two positive pigs are in the mix, depends on how many subsequent pigs get influenza deposit on their nose. Again, the recommendation here is that we've got a way that we can decrease transmission through the population by altering this weigh-in process so we don't have that rapid dissemination of virus through the population of pigs, with the idea that hopefully we would decrease overall viral burden and prevent transmission to humans. Limit show-to-show transmission is another one of those things that's listed to understand there's this really complex network of pigs moving. And so we've gone to shows, we've tracked zip codes of origin, and you can see there's this incredible network of pigs moving to all these shows. In this case, the pink is showing positive animals, and so you can see how they disseminate through the network and this incredible movement phenomenon and how quickly we can disseminate one particular virus through these pigs. And so obviously there's the concern of if we get a virus of concern into that network, how quickly we could disseminate it to multiple places where we would have plenty of exposure to humans. How you limit that transmission gets to be a little bit hard because they're going to these shows to earn points, and it gets a little bit difficult to prevent that move, but certainly we have to own the fact that that's occurring. Just to understand it a little bit more, there's this hierarchy of shows. And so, while we've been talking about the county fairs, those county fairs are the animal-human interface that we're interested in. But we have these jackpot shows that occur usually prior to the county fairs. That's what's creating the network, and that's what's disseminating a virus long scale. So understanding those key nodes and trying to put measures in place is kind of where we've moved to in our research program of trying to identify the key nodes in the network, work with those show organizers to alter their practices with the idea that we could then alter downstream effects, that we don't have to try to convince all the county fair organizers to do something here. If we can influence the whole network with a couple key nodes of where we're seeing widespread dissemination come out of, hopefully we can then alter what we have downstream. Just to kind of show you that dissemination to the network, I'm going to look at a H1N2 virus that was in pigs in this show season, which is 2018 show season. But if we look at it, right, it shows up at this Iowa National Jackpot Show, and then you can see that same virus ends up in Ohio, Indiana, Illinois, Michigan, Kentucky in these local jackpot shows and other national jackpot shows. We find it then in county fairs, and then ultimately a month and a half after we initially detected it in the pigs at that large jackpot show, it ends up causing human infections. Thankfully, those were kind of one-hit wonders and didn't go anywhere, and limited human-to-human transmission, if any, out of that. But nonetheless, the idea that could we influence that at that large national jackpot show in early June in Iowa and prevent some of those transmissions downstream certainly is attractive to us. And that's where we're trying to position ourselves so that we don't have these large, long-scale viral dissemination events. So as we think about that host, right, just I get this idea that we've got these pigs moving around. They go back to farms, they transmit it to other pigs, they take it to other places, right? And we've seen this time and time again. And so how we maintain virus in these animal hosts, I mean, we're talking about a very small niche setting. Nonetheless, right, it's certainly occurring, and we can see it occur here. As we think about other animal hosts, we can set up these same sort of transmission networks and realize this is how we're doing, or we're able to maintain some of these viruses in these animal hosts. One of the things that has come up a lot, and especially right, the mainstay of influenza prevention in human health side is vaccination. And so we've gotten a whole lot of, why don't you just vaccinate the pigs? And so we did a little study trying to look at that. We used killed virus vaccine that's licensed for pigs. We also looked at a live attenuated vaccine that was on the market. It's now off of the market, and then our sham. Not only did we look at the pigs after a challenge, but we also co-housed the pigs with some ferrets that were in direct contact, or at least as close as we could to the pigs, and then further away, so indirect contact, or at least looking at airborne transmission. The idea here is that we're using the ferrets as surrogates for people to look at the overall transmission dynamics that maybe are altered by using vaccine in these settings. We challenged those pigs with a completely mismatched virus that was not on point for any of those vaccines to try to look at, worst case scenario of what we might have. If we look at the effectiveness there, on the left, we're looking at the nasal titer coming out of the pigs. And so you can see the non-vaccinates certainly peak higher and with more virus and peak later. So a much larger area under the curve than what we have with either of the vaccine groups, irrespective of which vaccine we use. Interesting when we look at the ferrets, and so we're looking at right onward transmission from the pigs to the ferrets. The live attenuated vaccine seemed to have a better effect for us, but nonetheless, even the killed vaccine did have an effect for us. Now, granted, that's rather small effect, but nonetheless, it is an effect that we probably think would merit use, especially given the fact that the live attenuated vaccine is now off the market, and so the killed vaccine is the only one we have left. Recommending that would certainly be better than nothing, especially in that public setting. We could talk all day long about whether broad scale use of influenza vaccine in pigs is driving viral evolution and the return on that investment. But in this setting, these small subset of pigs that are on public display, I think we've got pretty strong evidence to support the idea of recommending influenza vaccination in those pigs. The other one that comes up all the time is about minimizing human exposure. And this one gets to be really tough, and we've said an awful lot about, you can't go to an amusement park and not see a sign that says, if you have these health conditions, this may not be the ride for you. But nonetheless, we don't really have that at these animal-human interfaces, and whether it's here or take your pick of, other markets and those sorts of things. We can also realize that people really aren't great at reading signs, and so we've got folks entering into the swine barn there where we've got signs indicating that you shouldn't bring strollers and pacifiers and sippy cups in. And I think they're probably all on that stroller that are rolling right past that sign. Now, granted, it's a white sign on a white barn, and it probably doesn't catch people's eye. And the no smoking sign is much larger than the threat about infectious diseases in there. But nonetheless, right, that's the situation we're dealing with. The other thing we look at is folks coming out of those barns. And so we sat around and watched people exiting barns, and did they use the hand hygiene stations? And so for the most part, fairs provide hand hygiene stations, have instructions about what to do and all that sort of stuff. We find a really dismal use of those hand hygiene stations. So only 7% of individuals exiting animal areas at barns, and in our observations, actually use those hand hygiene stations. And so, it's one of those things that, how do we affect that one? Again, we're trying to influence an awful lot of people to do something to take care of their health, whereas some of those other interventions we've talked about make it a lot easier to take control of the situation, because we can control it from the top or potentially influence it from behind the scenes and don't have to rely on people to do something. Last thing I just want to mention is we've also taken this approach to the swine exhibitors themselves and trying to influence those changes. So we have this active education program called Becoming a Scientist. And so you can get the idea of what we're up to here. We're teaching them about infectious diseases and infection control practices, biosecurity procedures, all these sorts of things. And so we've made this a go to them sort of thing. So we go to shows, we do educational activities with them, trying to drive home the points with the idea that we think we might be able to get behavior change amongst the youth. Maybe talking to the older audience isn't going to get the change that we want, but if we can get kids to change those practices, maybe they'll lean on mom, dad, aunt, uncle, grandma, grandpa, whatever it is, trying to get some of those changes made so that we can ultimately get some of those zoonotic transmission numbers back in check, where we aren't having every summer. In some cases, we've had hundreds in a summer of those transmission events occur, in which case the international community says, why don't you just stop showing pigs? Which at its face sounds easy enough, but I think once you realize how entrenched this is in some communities, it's going to stay. Like we saw it happen during the pandemic. Shows got canceled, and then there were pop-up backyard pig shows. It just continues. So I think you have to own the fact that it's there. Just in conclusion, right, this bi-directional interspecies transmission, and I know I focused this one way on pigs to humans, but realize that almost all the flu viruses in pigs today have come from humans, and we continue to see reintroductions of every season, right? Whatever the seasonal strains are in humans entered back into pigs. Interestingly enough, it doesn't seem to replace what's there in pigs. It just adds to the pile. And so the amount of genetic diversity of the flu viruses in pigs in North America today is absolutely astounding, and makes it that much harder to try to assess and predict which ones might come back across the interface. We know interspecies transmissions are going to continue to occur. It's the question of, can we, limit those, control them somewhat, and try to be ahead of them, doing risk assessments of those viruses so we know which ones we ought to keep an eye on and which ones, are, I guess, a little more run of the mill. Anyway, with that, happy to take questions.